feel like that I would really like for us to continue to transform our institution into one that is anti-racist and multicultural, and that we're not only looking at the differences of people and how to address that, more we're looking at how to dismantle racism and how do we look systemically at how do we play a part, what is our privilege, you know, and if we benefit from a privilege, who isn't benefiting, and can we see that even when we have instances where an incident might happen and a person of color might say, oh, that didn't really bother me, you know, and yet it's not an issue about whether it bothers someone. It's an issue about whether that person was treated in a manner that reflects having integrated aspects of white supremacist culture that we don't want, and that doesn't pull for inclusion and equity, and that doesn't allow us to contribute to, you know, society that gives everybody a place and helps like raise people that have been put down before. That's a thing that comes up a lot too. There's some, you know, marginalized populations and people of color populations have had this trauma, you know, for centuries. And so how are we saying or not talking about that when that's a reality, and people are learning more and awakening much more to that? There's also been this experience, like, you know, a tendency for, like, especially white clinicians to like say, well, I didn't mean that, you know, and the point isn't however you meant it isn't what's relevant. It's like once you said that or once you behaved in that way, it's not the point. The point is, how did that impact someone? Do you know, and like, how could we hear and understand what their experience, and how could we search ourselves, you know, to see where did that come from, and do I want that?